maybe you talked about success stories, but let me see.
Doesn't have to
Who
be a
is
success
already
story.
here?
Yeah.
Yeah, so I'm just going to invite Judith Anchang-Kimbi. Her microphone is already activated. She's an alumna of the FGS workshop, and she's going to tell us what she did after that workshop as far as her action plan is concerned. So over to you, Judith.
And you can see, you should be able to see on screen a summary of her story. Welcome, Judith.
Yeah, good afternoon, everyone. I hope you're getting me.
Loud and clear.
Yes.
Yeah, okay. So as from our last first workshop, we had a problem with our context. We tried to refine and redefine the context in which we are going to do our action plan. And we came across this small village, a camp. And we realized that in that camp, it's a camp where the Germans built a long way in the First World War. And the individuals who live in that camp are highly exposed to schistosomiasis. And that particular village is being surrounded by two streams. So, and they rely on the stream for their daily domestic activities. They don't have taps. The taps are not functional. Even their toilets, they are not functional. So they depend solely on the stream. And when we went further and investigated, we decided to find out from them if they know anything about FGS. They said they have no idea, but they know something. They know about UGS because most of the children, they have observed that children pass out blood in urine. So this kind of struck us much because even the health community worker, the health provider, they have no clue about FGS in this area. And the health district, it's around, but they don't know if they can use pelvic examination to diagnose FGS. They use pelvic examination for other urinary infections. And some of the women also express some worry, some concerns about some medical conditions, ill health, like itches, abdominal pains. And their suspicion is that they link these health conditions to the stream. So that again, it's something which we have to look into and really investigate to what level, to what extent are these individuals exposed to female genital schistosomiasis.
Dr. Judith
and I think
Anchang-Kimbi, thank you for sharing this so far. You heard about today then the pledge of the scholar, and I'm wondering, as you were working on this, you've already done significant work, it seems, since the FGS workshop. Does the pledge make sense to you? Is this something that you feel you are ready to commit to?
Yes, the community need a lot of help. They need a lot of help. And I think that with the motivation that I will get from this, I hope that I'll have all the mentorship to impact.
So if you join the FGS Accelerator, you'll be working, of course, with your colleagues in Cameroon, but you'll also be connected to practitioners in many different endemic countries. You'll also be connected to global experts who've worked in some cases on FGS and advocated for better prevention, diagnosis, and treatment of FGS for decades. What difference do you think that will make for you with respect to the work you are already doing? You did not wait for this to take action. What difference do you think it can make for you?
Well, I will feel I'm impacting something. I will feel I will achieve if I can go to that level to raise the awareness and let the people know how serious this disease is. And in my own little way, I think that I will feel happy that I'm able to solve a problem. Yeah.
Thank you. And I'd like now to turn to let's see, Julie Jacobson. Julie Jacobson of Bridges to Development is one of those global experts who has been working on female genital schistosomiasis and fighting so that it's no longer a neglected tropical disease. Julie, a warm welcome to you. We just heard our first story shared by Dr. Judith Anchang-Kimbi. What are your thoughts as you listen to her and the dilemmas she's facing?
Thank you, Retta, and it's a delight to be here with so many amazing people trying to take on this challenge of the hidden burden of female genital schistosomiasis, which is throughout sub-Saharan Africa. And Dr. Judith, you've done a wonderful job of recognizing one of the key pieces is how are people exposed to the parasite. And so it comes from exposure to water sources that have been exposed to the parasite and have snails, which increase the level of parasite in the water. Contact with that water is the parasite goes through the skin and then infects the individual. If a village has urinary schistosomiasis, then they have genital schistosomiasis. It's the parasite affects not just the urinary tract, but the genital tract. It's just that people don't recognize the symptoms that they have, and they're frequently considered to be sexually transmitted infections. It causes birth issues. It causes infertility. So you are exactly on the right path here. Finding those villages that are at risk and exposed, prevent that exposure, try and help take care of the environmental pieces, let the villages know that they are at risk of these symptoms, how to get treatment, and make sure that they have availability of praziquantel to treat the population, not just the girls and the women, but the whole population for their exposure to schisto and prevent that. So you're on the right track. You've done an excellent job. I'm really excited to hear about the work and your pledge to take this on, because it'll only happen through all of these active and beautiful minds that are here today in your own country, seeing what's happening and being able to solve the problem as you see it taking place in your current setting. So thank you.
All right, thank you, Julie Jacobson. And you'll be hearing from many of the other subject matter experts who really went above and beyond to support practitioners in the FGS workshop in May and June as part of the FAST package, this amazing project to bringing together many practitioners